Our next speaker is Professor Jack Gleeson from UC Cork cluster.
Thanks, Seamus, and good morning, everyone. I'm going to present today on behalf of my colleagues across the UCC Cancer Trials Group. So, first of all, as an overview, our cluster encompasses CUH, or Cork University Hospital, the Bon Secours Hospital in Cork, University Hospital Waterford, and the University UCC. And our collaborators and funders are listed here, predominantly the HRB, as well as the HSE and our clinical research facility. We're currently in year 4 of our grant, and this slide just highlights really a lot of the work that was done in terms of governance and improvements in terms of strategy. We now have 5 strategic objectives, 4 work packages. There are separate trials units in University Hospital Waterford, in Cork University Hospital, and in the Bon Secours, who have all been brought together under this cluster and this framework. There's a governance board, and really our operations have significantly improved. In terms of some successes across the work packages, we now have a core team similar to other sites, with a project manager, executive assistant, and academic study coordinator who's been really helpful in developing our IITs. We've launched our brand with sub-brands for each of the units, which has been quite successful really in terms of bringing everyone together and under the same umbrella. There have also been successful events. We held our own retreat back in 2022, and then we have established a PPI panel, and there was an excellent Art for Knowledge event which involved a lot of PPI representatives and really helped develop the PPI panel. We went through the OECI accreditation process similar to other centres, and are due to receive our certificate in a couple of weeks' time. And there's been a lot of success as a result of the HRB grant in terms of expanding our portfolio and IIT development. We've linked better with our surgical colleagues, our palliative care colleagues, our hematology colleagues, our radiation oncology colleagues. We had success with the Irish Cancer Society, Men's Health Initiative and Women's Health Initiatives. And there have been a lot of international collaborations which have come from work through the UCC CTG group. And that really strengthens our position when we go to these international collaborators. In terms of our IITs, or our investigator-initiated trials, cancer microbiome has been a big focus for us in the hospital and in terms of trial development because of some of the strengths in the university, and bridging the university and the hospital has been a big focus for us. We've also worked with our hematology colleagues, and again under our Living Well with Cancer kind of strategic aim, with both the LISA trial and the Liam Mac trial, which are essentially supportive care initiatives for women and for men. And they've been very successful and supported by the Irish Cancer Society. We've had a total of 15 CTG studies supported to date, and Dr. Aaron Crowley, who's our academics trials coordinator and is half-time with us and half-time with the clinical research facility, has really helped to establish those IITs and navigate the pathways. We've also developed an investigator forum where we share information on open trials to try and help increase accrual and cross-site sharing and patient referrals, so that patients get access to open trials, and the clinicians and the investigators have the most up-to-date knowledge on trial activity. This did lead to an increase in our accruals across the grant timeline. I only have the 3 years of data in this, but not compared to the prior period, but there was a significant increase in terms of our accrual numbers, and our number of open trials, which is on the bottom of this slide, have increased year on year. One of our focuses, our work packages, is on training the next generation. We've now had 2 breakthrough cancer research sponsored clinical fellows. Our second, Dr. Emer Lynch, started with us in January. And we've had 2 further appointments, myself and Professor Aisling Barry, along with Professor Roisin Connolly, our director, who all have academic time as part of our contracts. So all 3 of us are 50-50 split, which is really helpful in terms of being able to dedicate time to research and to clinical trials. There's also been a big focus on our more junior trainees or working with our colleagues, and a lot of this is our non-medic healthcare professionals. And one of the highlights, I suppose, in terms of successes was Kate O'Connell, one of our survivorship nurses, presenting an oral presentation at ASCO in 2024. So a big success from our team has been supporting those allied healthcare professionals to conduct research. And through the Liam Mack and Lysis study, which involved physios, dietitians, that have all now become very involved in research and plan on bringing that forward. So I think that's a big success. In terms of learnings, like Michaela mentioned, hiring staff through the university was a way of bypassing the embargo in the HSE, and worked quite well. And we now have quite a number of staff in the HSE, in our cancer trials unit, who are seconded from the university. We also have established a PPI panel who are very helpful and informative in terms of helping us to develop our trial ideas and to get involved in studies. They're extremely giving of their time and extremely helpful for our research development. We have an open trials newsletter, a regularly updated website, and an online Excel, which we are hoping to move towards an online database platform that's shared across sites. So we are working on that. I know Michaela mentioned it as an issue, but we're hoping we made some progress recently in CUH at least. Like all the other sites, I think there have been challenges, staffing issues, retention of staff, and difficulties hiring and attracting staff, lack of clear career pathway for staff, and lack of ability to further their careers for some of our staff have been highlighted as issues. The Unified Clinical Trials Database has hit multiple delays due to regulatory issues and information sharing across sites, but we are hoping to get past that actually just recently. We only have a few PIs with protected academic time, but those few have led a number of the bigger accruing studies over the last few years, and does certainly allow access to more patients to get on clinical trials and to be involved in our studies. And another challenge that was highlighted was the evolving social media landscape in terms of making it challenging to consistently manage and align our both individual and group brand identities. So I'll leave it there and happy to take questions later.